Good evening and welcome to the second of our lymphoedema webcasts here in Sydney, but you are joining us right around the country. First of all, my name is Kirsten Polati. I'm the very proud CEO of Breast Cancer Network Australia. Tonight we have so much on the schedule, but before we get started, I would firstly like to acknowledge all of our Aboriginal and Torres Strait Islander viewers and thank them, the elders, the present and future emerging leaders in the Aboriginal and Torres Strait Islander. You are a very important part of our network, and so we welcome you tonight. And thank those who were the elders here in Sydney. So tonight we are going to be talking mostly Q&As. We have had hundreds of your questions that have come in thanks to the first lymphoedema series that we had. And so thank you for sending those questions in. Again, tonight you can continue to send those in, and I would like to acknowledge our amazing facilitator of those questions, Christine Mitchell, a long-time BCNA member and a fantastic advocate for people living with lymphoedema across the country. So thank you, Christine, for once again volunteering your time. So send your questions in to Christine and make sure you tell us where you're from so we know more about that. But tonight I am joined by three incredible people who can help us to understand the real impact that lymphoedema has on the life. So to Professor John Boyage and to Louise Kohlmeyer, both from the Macquarie University. We'll hear from you in a moment. But as everyone knows, BCNA is all about those women and men who've been affected by breast cancer. So first of all, I want to welcome Wendy Mann to the panel. And Wendy, can you tell us a bit about your experience with breast cancer and with lymphoedema?
Thank you, Kirsten. My first experience with breast cancer was 32 years ago in my mid-30s, and then things were vastly different by way of the advice and help that was available. So the only advice I got at the time post-surgery, it was just a lumpectomy, followed up with radiation and chemotherapy and an iridium implant. But the only advice was walk your arm up the wall. I carried on, young children, work, and I sailed along quite nicely for a couple of years. And then all of a sudden I was on a flight and I visually watched my left arm swell up. So panic set in. And I can still remember how terrified I was about the homebound flight. But anyway, I started to manage it after that, and I've had extensive massage over the years. But what I think I've learned most of all is about self-management. I do wear a compression sleeve when I fly. I do know the things not to do, and I do know the warning signs. One of the biggest things for me is I get sore clavicles if some sort of infection is setting in. Also, personal massage is a no-no for me. I was telling Louise I walked out of a masseur one day and I looked at my arm and there's red spots everywhere, and it rose that quickly. So things like that I avoid. I do dragon boating. I do lots of other sport and activity, but I think the big secret is to self-manage it. 17 years post-first breast cancer diagnosis, I had a second one, chemo, and then 4 years later or 3 years later, a prophylactic mastectomy. But none of that, and transflap reconstruction, but none of that had any impact on the lymphoedema because I think I'd already learned to manage it. So I'm sailing along quite nicely now.
Well, it's so great to have you here. And what we want you to do is share your very personal experience, if that's okay, with us so that we can all learn from that. Can I remind people, and thank you, Carol, for being the first person off the rank with your questions, to keep your questions coming through. The first edition of the lymphoedema series really covers a lot more of the what is lymphoedema and some of the very practical treatment options that there are for treating lymphoedema. So tonight, as I said, we're going to go through more of your questions and answers, the hundreds that came through after the last session. But John Boyage, welcome. You have had a long and incredible history in breast cancer. And first of all, I want to thank you for the work you've done for men with breast cancer, because I know you've made a significant difference to them, but also in your leadership in lymphedema. You must be so proud of what you have been able to do at Macquarie. But I wonder if you might talk us through just a few backgrounds before we get started into everyone's questions that are starting to come through already.
Okay, thank you. And I won't be too long, because I know we've got 700 people out there that really want our advice, and really leadership is about having a great team around you, and being with Louise today is a proud moment for us. But look, we established the lymphedema program at Macquarie back in 2011, 2012, when I was approached by Dr. Helen Mackey, and a lot of you out there know Dr. Mackey. She's like the, this lovely national treasure on lymphedema, but she asked me if I knew a plastic surgeon who could do liposuction for lymphedema. And, I really thought she had rocks in her head. And as a mere radiation oncologist, I was taught you couldn't put needles in and you couldn't do all this sort of stuff. And suddenly she's telling me you suck out fluid. I always thought it was fluid, but it turns out to be fat in many patients with advanced lymphedema. So we started a surgical program, and I said to her, look, if you can get the team together, get a surgeon from overseas to teach us how to do it, find a patient. Louise finds a patient in 5 minutes flat. A surgeon from Scotland, we flew him in, and we did our first case. And we've done it probably over 120 now. And from there, we just realised that there's so much gap in service to patients with lymphedema, not only breast cancer, but, lower limb edema and genital edema and head and neck edema. It's a tragedy for the lack of resources. And so we put together a research program, an education program and a treatment program. And that includes conservative treatment right through to advanced imaging. We've got some amazing diagnostic techniques called ICG, or fluorescent imaging, and MRI imaging. And Louise is just going to mention really briefly some of the conservative treatments, and then I'll come back and talk about some of the surgical treatments.
Okay, great.
Thanks, John. So when we talk about lymphedema management, there's a whole range of strategies to manage lymphedema. It's really important that you have a comprehensive assessment and see a qualified lymphedema therapist. And then what you can see on this slide is CLT, which stands for Complex Lymphedema Therapy. CLT offers conservative treatment, and it involves 2 stages of reducing the arm volume and then maintaining that. And I really like what Wendy said before. It's really a lot about self-management, and exercise is a key component, compression therapy is a key component, looking after your skin and working in partnership with a therapist. And all of these things really need to work in with your lifestyle and talking to your therapist about what's going to work best for you.
And I know we covered a lot of that in our first lymphedema series. So if you have not watched the first lymphedema series, please go back to that, watch that, and then we will be dealing with some of the questions that came from that kind of basic information around lymphedema. So, John, you're going to continue on for us about the surgical options.
Look, I know, Kirsten, one of the questions was about surgery. And look, the reality is surgery is still, a lot of it is research-based. There's a few centres around the world that are centres of excellence, and one of them is ours at Macquarie University. We were recently invited to Harvard University to present our model of care. And let me tell you, so many people were stunned that we're probably one of the few groups in the world that bring a whole team together. And this was basic for breast cancer back in, wasn't happening back in your day, but, in the 90s was a BCNA and National Breast Cancer Centre. We brought teams of doctors together, but nobody's done it for lymphedema. And we started with liposuction because as lymphedema gets advanced, it stimulates fat cells in the arm. And a lot of you know out there that garments stop working and massage stops working. And a lot of the time it's because there's fat and you can't get rid of that except for liposuction. And we've then learned new techniques of joining, for early lymphedema, joining these tiny lymphatics, which are 1/3 of a millimetre, to very tiny little veins to try and bypass the blocked lymphedema. And that's for very early lymphedema. And also for some patients who are really motivated to try and get off garment, we're also looking at lymph node transfer. And we've done probably over 120 liposuctions, probably 15 to 20 LVAs, lymphovascular, and about 20 lymph node transfers. So we know early stages. We don't rush into surgery. We have this team that I chair, quite an amazing team. We have patients from all over the country in New Zealand. 40% of our patients come from right across the country. They fly in, they stay in local accommodation, and we do fancy tests on them. And then sometimes tell them they don't have lymphedema. They might have lipedema, or they may have something else going on. And but a lot of the times we recommend conservative treatment. We see surgery as a last resort. Yeah.
So are most of the people that are coming to you, John and Louise, coming because it's severe? It's at a point where they've exhausted all of their local support services and they need to be escalated to you, is that?
Yeah, I mean, they've tried all the conservative treatments. They've tried, and their life's been affected. It might be recurrent bouts of cellulitis that I'm sure we'll talk about later. It might be the fact that they can't put on clothes anymore. That they can't wear a jacket. You can't wear pants or boots and it's desperation many times, or they can't climb stairs. So. Or maybe a heavy arm, several school teachers who can't write on the board anymore. I know don't do board much anymore because it's more electronic, but the principle's still there.
Yeah. So we might go to questions, if that's okay with everyone, because they're coming through thick and fast. So I'm going to deal with Carol first because she was straight off the blocks. So Carol asks us that she's been told not to use spas and to be careful of the temperature of water when bathing. So what is the best temperature? Let's deal with that first. Louise, do you want to answer
Generally,
that one?
we say a heated pool in a hydrotherapy type environment, which is about 26, 27 degrees at the hottest, we'd recommend. You wouldn't necessarily sit your big lymphedema arm in a spa bath hotter than that. And often I say, if you want to sit in a spa bath, do that, but put your arm that's got lymphedema on the ledge of the spa, so it just hasn't got that continuous heat building up there.
So Carol had lymph glands removed 15 months ago. Should she be experiencing numbness under the arm, John?
It's very, very common, and when there's a nerve that the surgeons have to, they say, sacrifice, which supplies the skin under the arm, and most people have that numbness. It's not dangerous. It's a real nuisance because you can't really feel your arm, particularly if you're trying to shave, and you've got to be careful when you shave. But it's normal. It gets better slowly, but often just persists for. I'm not sure when you've
forever.
Got it.
I can tell you.
You got that, yeah.
Absolutely. But it's nothing really.
Yeah.
Yeah.
So, Wendy, what kind of precautions do you take in your life to kind of minimise? You said looking after yourself was the most important thing.
Well, actually, supporting what Louise said about spa baths. I used to have a spa bath in my previous home, and I would never put the arm in the water, exactly what you're saying. And back then, someone said, don't use aluminium deodorant, so I've never used a spray deodorant since. And I feel somehow a roll-on is better. Shaving, it's just a hit and miss, as you say, still, all those years later. Well, actually, not here much. There's not much growing these days. But sign of the times, I guess, the age. But that would be the main things in regard to what we've just spoken about, yes.
So one question that did come up, and Kathy, who's in Canberra, so Kathy, I'm sure you can't wait for this weekend to be over, but Kathy's talking about breast and chest lymphedema, and it was interesting to me when we did State of the Nation, John, how much this actually came up through all of our consultations, and actually we had to reflect at BCNA on how little information we had. Yeah. Has it increased over? It seems to me like it's emerged as a more ongoing issue, and what is it?
Well, thanks, Kathy. It's a great question, and it is the ignored edema in breast cancer patients. I recently presented a paper at this Harvard course on breast edema. There was absolutely nothing there on breast edema, and they asked me to talk about lymphedema, and there's so many people. I said, what about we talk about breast edema? And to be honest, there's not much out there. We know after surgery in sentinel node biopsy, axillary clearances, you're blocking the lymphatic flow from the arm and the breast. And essentially, the fluid basically doesn't move as well in the breast. The breast gets heavier. You may see indentations in your bra or your sports bra or clothing. And unfortunately, you can get cellulitis, and that can make it worse. And I am seeing a lot more of it. And my view is that surgeons, back in Wendy's day, I know you told me you had Professor Bruce Barraclough, who I worked with. They used to use tiny little incisions for breast conservation. These days they're doing a lot more oncoplastic surgery, they call it, a lot more bigger scars and flaps and so on. And what is happening is the surgeons are cutting right through a whole bunch of skin lymphatics, and that is causing more of a problem.
Yeah. So, Louise, how do you treat that? What are your tips to people who may be having this as an effect?
Likewise, I'm seeing a lot more breast edema these days. And the little thing to find out whether you have breast edema is look into the mirror and have a look, is your breast cancer side larger than the other side? Also look at the end of the day when you take your bra off, whether you've got big indentations on your cancer side as opposed to the other side. And if you've got indentations on your cancer side and not on your normal side, that probably means that there's extra fluid in the cancer side, breast edema. And if that edema is there for longer than 3 months after you finish your radiotherapy and your chemotherapy, then it is probably to be breast lymphedema. And I would recommend that you start doing some lymphatic drainage massage, and probably best to be guided by seeing a lymphedema therapist to help you work out what direction to drain that fluid to try to soften the breast and help reduce some of the scar tissue that might be blocking the fluid. Also, there are special compression bras and garments that you can be fitted with to try to help drain the fluid and help make you more comfortable and to support the breast.
Thanks, Louise. And Claire has also added to that question, is there any danger in not draining it if it's not feeling particularly uncomfortable in the breast lymphedema?
Most women who I see are coming because they feel it, feels uncomfortable, feels full and feels heavy and looks different to the other side, and it's usually of concern for them. I guess exercise and moving and trying to just keep things flowing, particularly doing some scar massage, helps to try to just keep the pathways open. So while it's not bothering you, it's probably okay, but I'm a big believer on early detection, early management gives you better outcomes. That's for arm edema, but I also think for breast edema. So it's worthwhile looking in the mirror, seeing, is this a problem for me? Perhaps I can do just some simple massage to help move that fluid.
And John, you wanted to add to that?
Claire, sometimes in the first year, your breast edema can get worse, can be sometimes worse in the summer months as well. But then it slowly does get better in many patients. So you get this sort of post-operative, post-treatment change, and then it gets better. But our research has shown is what you sort of got at about 3 years after treatment is what you learn what to expect. And if it's still worrying you, of course, we've got better early intervention now, and therapists know how to treat it.
Yeah.
If I could just add,
Yes.
Claire, definitely learn that massage yourself and get right onto it, because that comfort that can bring to you is amazing, and it stops it progressing. That was definitely my experience.
Yeah, exactly. There was an additional question from Jess around if you can get the breast edema with an implant, or is it only with normal tissue? Tricky one, John.
I'm not entirely. Does that mean a breast reconstruction, mastectomy, and an implant?
Yes, sounds like that's.
We don't see it much with an implant at all, but there have been some studies in patients who have had a flap reconstruction, so that the tissue around the flap can be more. You've got some experience with that as well.
Oh, not personally, but
but
heard
yes,
of it, yes.
So there's been some studies looking at flaps and how you can get edema around the flap. So we do see it, and you've also got to be careful that sometimes edema very, very rarely can be a sign of a problem, perhaps even a cancer coming back. So you've got to be, if it's unusual and it's getting worse and you may be getting pain with it or something like that, always make sure you see your breast cancer surgeon or oncologist.
Yeah, and I think that's the key, isn't it, too? If you're at all worried, go and see someone, because I think
Absolutely.
many of our women and men who've been affected by breast cancer don't want to bother people, but guess what? Start bothering people is our advice to you, so until you can get the support. There has been a number of questions, Louise, about support for regional Australians and, having travelled to so many places around regional areas who don't have the same lymphedema services that metro areas have. What's your advice to those people, and what are some of the things they should be doing about reaching out for support services?
I guess looking at information that's available on self-management strategies, linking into support groups. So the Australasian Lymphology Association, you can see that website on your screen, does have access to therapists, and you can put in your postcode wherever you live across Australia and New Zealand to access a qualified therapist. But then also learning some exercise strategies, keep active, and there are lots of guidelines and information online. And certainly welcome to contact our education group at Macquarie University, that we can put you in touch or help support you with some self-management strategies.
We've got a lot of videos online as well from visiting professors that
Give some self-help.
whole lot of stuff on cellulitis, for example, and early detection.
Fantastic. So I think that's important to reach out. And so Alison, who's in Bega, has had a pretty horrendous experience of long wait times for lymphedema services and a real lack of anyone in her regional area being able to fit her properly for a sleeve. So I think reaching out to those services, and to let you know, Alison, that dealing with lymphedema and making sure we have the services available, and very importantly, the garment program in place nationally is a key priority for BCNA, and really we know is a very big unmet need. And so hence these webcasts are coming to you. But Alison, I would encourage you to reach out to our helpline, but also to Macquarie University, where we might be able to connect you in with local services as well. So I want to go back to a question that came up and has also come up in many of our forums, John, about cording, because it appears that it happens early post-surgery. And I think if we can just spend a couple of minutes on giving people some really practical tips on cording, why it happens, and is that then an indication that you might be at higher risk for lymphedema going forward?
So perhaps Louise and I can talk a little bit about it. It's also called axillary web syndrome. It's Louise sees it more than I do, but when the few cases I've seen, there's like a little cord. Sometimes there's a little bump above the elbow, which is like a lymph node. And our view is it's probably a fibrosed lymphatic. We can see the lymphatics, and they do with our advanced imaging at Macquarie. And we know that this is a bit of fibrin blocking the lymphatic. And it sort of makes sense that if the lymphatic's blocked, can that increase my chance of lymphedema? Lymphedema is sort of like an evidence-free area. And when I looked up axillary web syndrome today, just to see if there's anything new on it, there's only one study from Germany where half the patients with cording had physiotherapy alone, and the other half had physiotherapy and CLT. And the ones that had CLT and physio did a lot better with zero lymphedema. And the ones that just had simple physio had a bit more lymphedema. I'm talking about 20 or 30%. I think it's probably an overestimate, but I'm going to hand over to the expert here.
So just leading on from what John has said, the cording, it's more commonly in the first 8 weeks after surgery. That's the general time that we see it. And you can actually feel, if you put your arm up, you can actually feel under your arm that it feels like a piece of rope, okay? Or sometimes it can feel like guitar strings, so a few little strings under your arm. And as John said, it can sometimes go from under the axilla and go right down towards the elbow or even further down. The problem is relating to up under the axilla. So even though you might have pain and discomfort down your arm, and what you can do yourself to try to reduce that pain is to actually do some firm massage. So wherever it is feeling painful, doing some firm, deep circular movement all the way up that armpit area, but then some firm circular movements around where that's starting from under the axilla. And if you're finding that it's not really releasing for you, then certainly see a physiotherapist who can treat it. Probably a couple of sessions can release it and really target that area to give you a lot more freedom with your movement. And often after you get cording released, then your full range of movement helps quite significantly. So it's not a long-term problem. I don't necessarily see it relating to onset of lymphedema, but it's something that can be quickly fixed if you go and see a physiotherapist or do a little bit of self-massage. But don't just do the massage on your arm where you're feeling that bit of pain. It's really relating to tightness under the armpit area.
Thank you, Lois. That's fantastic. So Rhiannon has said, following on from your question, Wendy, or your thing about massage, is she doesn't have lymphedema, but is obviously potentially a bit fearful of the risk, which is very real for most of our members. Is it a no-no to have massage full stop? Because that would be a bit awful, wouldn't it? To not be allowed.
Be, yeah.
So she can continue to have a massage? Yeah.
Yes.
Yeah.
Just don't let them be too vigorous. That was my experience, just with a traditional massage.
I think we used to wrap people up in cotton wool with lymphedema, and but these days it's like, you know, get to know your own body, exercise, don't be afraid to be in the garden and so on. But, you know, take precautions, but don't.
I went through all that bandaging with the cotton wool and took it all home thinking I could do it myself, but fortunately things have moved on.
I can't believe the change, and I thought it was interesting, Wendy, that you said you were told to move your arm, because so many people say that they were told to keep it movement free. So,
and I was actually very fortunate. A girl I worked with had just had exactly the same surgery a few years before, but she said she was a hairdresser, and she said, "Just keep it moving, Wendy, keep it moving," and I did.
And the greatest gift is other people who've had the experience sharing their experiences with each other. It's so much more powerful. In fact, I was saying today that our members knew the benefits of acupuncture well before it was documented in research. So how special it is to have each other sharing your own experiences.
Yeah, and you're not a patient, you're really.
Yeah. So there's a question in here from Leanne in Brisbane that she is going to the gym, which is awesome, and doing weight-bearing exercises. Should she wear her compression garment on the arm while I do the exercises?
Okay, I can answer that, Leanne. If you're wearing a compression garment because you have lymphedema already and you're normally wearing that garment for day-to-day activities, then I would suggest that it's well worth you continuing to wear it while you're at the gym. If you don't have lymphedema and you're thinking, should I be wearing a compression garment when I go to the gym? The research is really out there saying not necessarily. So if you've got a compression garment because you've been fitted with it, because you've had some symptoms or some swelling, and when you wear the garment to the gym, it provides some support to your arm, then feel free to wear it. But you don't have to wear it if you're not routinely wearing a compression garment.
Fantastic. And I'll follow on the questions. They're coming in thick and fast, so I'm trying to manage it. I do feel even more full on than Tony Jones tonight on Q&A. But keep your questions coming. Christine is waiting for you to send those through to us. But aqua aerobics, is it valuable in lymphedema?
Definitely, aqua aerobics is a great activity. If you're exercising in the water and your shoulders under the water and you're moving your arms within the water, that's resistive training. We've got that resistance of the water, so really beneficial. But I often have patients who say to me that they hate going in the water. They've never swum or they hate getting their hair wet. Should I be desperately doing aqua aerobics? The big key message with exercise is we want you to exercise, but we want you to start doing something that you like doing. So if you're not a water person, then go and do something out in the sunshine, go for a walk, go for a run. Whatever exercise you like doing, you're going to be more motivated to want to do it. And any type of exercise, resistive training, cardio, is going to be beneficial for your lymphatic system.
Exactly. Yeah, John, you wanted to...
Just very quickly, you need to look at weight-bearing exercise as well. And aqua aerobics is not weight-bearing, so a lot of patients, we worry about their bones with some of our treatments and hormonal treatments. So mix it up a little bit as well. Maybe some brisk walking, half an hour, 3 times a week.
Yeah, strength, resistance training, right?
Yeah.
We need all of it to, a combination. So we have had so many questions following last lymphedema session on cellulitis. John, can you start first with telling us what is cellulitis? And then maybe, Louise, I'll throw to you on the treatment options for that.
So lymphedema, we remove some glands or give some radiotherapy. I always see it like a river that has rocks in the way, or it may even be like a motorway where suddenly you get a toll. You get this blockage and things slow down. So a river that's slow can be not as clean as a fast-flowing river. And if somebody has a little scratch or a bug, then that may cause an infection because the bug can't get away and be got rid of by the body. So cellulitis, had a poor lady in my clinic on Tuesday. She's already had 4 episodes this year. She's had yearly episodes since the breast cancer about 8 years ago. And for her, she said it happens so quickly, bit of redness, pain, sometimes a temperature. It feels hot, and you need to jump on that really quickly and get onto some antibiotics. It's often sensitive to penicillin, or if you're allergic to penicillin, some Keflex. And for some patients, this poor lady yesterday said, I was stuck in a regional hospital in the emergency room. They wouldn't listen to me. I knew my body. I knew I needed those antibiotics, and they just kept her waiting for an hour and a half, 2 hours, but she travels now. She has antibiotics in her purse, and I think that's really important. But it can be dangerous, but it responds so quickly to antibiotics. What we do know is that patients who have liposuction have a much reduced incidence of cellulitis. So if you're in one of the advanced cases and you have this chronic cellulitis, and in fact I'm sending her off for an MRI scan, an ICG imaging scan to see can we do something in terms of surgery for her, because her life's a nightmare. She has time off work.
What kind of percentage would we see of patients going on to develop cellulitis?
That's a really good question, and BCNA helped us find the answer, because we did a paper. We used the BCNA database looking at work and impact of work and cellulitis impact on work. We found that patients who had early lymphedema in the past year, 7% had cellulitis. Patients with advanced lymphedema, 29% had cellulitis. Now, half of that population, half of them had to go into hospital. The longest stay, I think, was 14 days. Imagine the cost of that.
Yeah.
And, fantastic news about the garments you were saying earlier.
Yeah.
We know that garment use can reduce the incidence of cellulitis. Good care.
Yeah. So, Louise, what are your kind of top tips around cellulitis, and how do you know that that's what you've got rather than a severe kind of lymphedema? Yeah, what's the distinction for people that they should draw?
So really, Kirsten, agree with John, you're going to feel a bit off. And if you're wearing a garment and you take the garment off, often you've got this redness in your arm and it feels warm to touch and just feeling feverish and not well. Go to your GP straight away. Take that garment off initially. In the past, we said keep the garment off for probably 1 to 2 weeks after an episode of cellulitis. However, more recent research is showing us as soon as the initial cellulitis symptoms settle down when you've got antibiotics, then try and get your garment on as soon as possible, as soon as you can tolerate it again. So that's the big thing that we're really promoting these days. I wouldn't be suggesting doing any manual lymphatic drainage massage while you've got an acute infection, an acute episode of cellulitis, and really get those antibiotics quickly. I agree with John, keep a script in your handbag so that if you need them, you can get them very quickly from your local chemist. And take care, look after yourself, because sometimes it could be that you've got this bug, you've been running around doing a whole lot of things, you need to look after yourself. Drink lots of water and keep hydrated, and then try and get that compression garment on as soon as the initial symptoms
And
settle.
I would just add there, it can hit you ever so quickly.
Yeah.
1 minute you're okay and then you're not. So I'd even go one further than have the script. I have the actual
Yeah.
Tablets.
tangible product there.
Yeah. Good.
Particularly when you go overseas, I
Yes.
recommend all my patients take at least 1 or 2 weeks of antibiotics with them. If you've got lymphedema, take it with you,
Yeah.
and not in your baggage underneath, in your
checked
handbag.
baggage.
How many episodes have you had?
Over the years, I've probably only about 10.
10. That's a
But
lot.
I haven't had
That's a
any.
lot. That's
I
a
haven't
lot.
had any for a few years now.
So there is another question, Louise, I'll throw to you about wearing a garment on a long haul flight. It came up in the first lymphedema session, but do you want to give us a quick tip around people flying?
Yes, I recommend if you're in what we call high risk for developing lymphedema, so you haven't got lymphedema, but you've had an axillary clearance, you may have had some radiotherapy, and you're going on a flight longer than 4 hours, I would recommend getting fitted with a compression sleeve and gauntlet, a little mitten, that you wear for the duration of the flight. It needs to be properly fitted so that it doesn't cause any pain or discomfort while you're wearing it. And the other key message is use that sleeve as a bit of a reminder to move your arm while you're on the flight. So I usually say once an hour while you're on a plane, just do some exercises. Put your husband next to you so you're not hitting someone that you don't know.
She does that at work, you know.
But another important thing is often you're going on these trips for a bit of a celebration for getting through breast cancer, and you might want to have a glass of wine when you get on that plane to help you sleep. But if you're having a glass of wine, make sure that you're having 2 glasses of water and really keep hydrated to help your system during the flight. So yes, good sleeve is important if you're at high risk. And don't just put it on the moment you're about to board the plane. I usually suggest to my patients that they get the sleeve, they wear it around the house for a few hours or a day when they're at home not doing much, and also wash the sleeve so that you're not putting a brand new sleeve on that might irritate the skin. Wash it, wear it for a few hours at home before you then go on the flight.
What about for flights for breast lymphedema? Any tips for those people?
A properly fitted, good, comfortable bra. And if you've got some breast edema, then get a compression bra. So they're not the sexiest looking bras, but they really do serve the purpose of controlling and supporting a heavy swollen breast.
Yeah. So we don't have very long left, so we've got a few questions I'm going to whip through. So Paulette asks, if the lymph fluid isn't draining from the body effectively, does this increase cancer risks? John?
No. Next question.
Next question. I have, this is from Lee, I have lymphedema in my right arm. Not only is it larger than the other arm, it's hairier than the left. Why does it have more hair and darker hair than the other one? And I'm fair skinned. This is a new thing for me.
I've never heard of this.
I've never heard of it.
We'll take that on notice, Lee, so leave that with us. Kathleen, can you have acupuncture on the affected area? Louise?
This is one of these areas where there's lots of myths out there about lymphedema that we talked in session 1. Probably there's no scientific paper to say you can or you can't have needles. I guess it gets back to putting needles in your arm and the potential risk of infection. But if you're under clean, sterile circumstances, there's probably not a problem. Again, just be cautious with who's treating you. Talk about lymphedema to them. Let them know why you may be a little bit concerned, and use other options as well.
John?
Look, probably a more important question is, can I have a blood test from the arm? Because that's a needle as well. And a lot of you are really protective of your arm, and that's the right thing to do. But sometimes if you've had chemotherapy and all your veins have gone, you know, the blood drawers with good aseptic technique are able to take a blood test without increasing your risk of cellulitis or infection.
The key is good.
Yep.
There,
Yep.
John. But Paulette really talks about the frustration that she has felt around people not understanding chest and breast edema, and that it took ages for her to explain it. There is a lot more going on in the education of this area, but it's fair to say there is a lot more work that still needs to be done. So my suggestion to you, Paulette, is when that happens, get on Macquarie's website or BCNA's website, download some information about it and hand it to the health professional who might need a little education, because sadly there are many health professionals who are still not well versed in this area of lymphedema. I don't know if you've had experiences of having to teach health professionals about your experience.
Oh, definitely. What's lymphedema?
Yeah, exactly. So there's still so much more for us to address. So we are only having 5 minutes to go, and thank you all so much for all your questions that are coming through. I really like Grace's question, which is there hope in the future for a cure?
Maybe I'll start with that one.
Yeah.
Look, I think there is hope, and we last week I was contacted by one of the best professors in the world from Stanford University, and Professor Stanley Roxon, and he asked our group to be involved in looking at tablets for lymphedema. We've already done one trial called the Ultra study. He now wants to look at a simple anti-inflammatory drug. We know that a lot of this is gunky fluid which causes inflammation, and that causes a fat stimulation. And we think even drugs that can be used to treat arthritis may reduce that inflammation. My hope is that in the future we will de-escalate our therapies, we will do less in the armpit, we will be doing better sophisticated radiotherapy. We're already doing that now, partial breast irradiation, and being more alert, to use our acronym, to the fact that lymphedema is a very important issue that women and men worry about and affects their quality of life. You can hide a mastectomy scar, but you can't hide an arm with a sleeve, when you have to check out at Coles.
It's interesting, we on another webcast had work and breast cancer, and there are many situations where people are having to change their work practices, including, we had a young single mum who was a night filler at a supermarket who could no longer night fill because of her severe lymphedema. So there is a lot of discrimination that we know is happening around the side effects of lymphedema, and because it's not taken seriously enough, which is why we do so much in this area, really. Louise, would you be able to explain in 30 seconds, no pressure, how and when the pumps would be of benefit to use?
Compression pumps are a really valuable and useful addition to your self-management for lymphedema. So we call them pneumatic compression pumps. You put them on, they're like a big sleeve. You can now actually get them that have a vest component as well, that we're trialling at the moment for breast and chest wall edema. There's different settings of the way that the pump can work, so different directions that it can be set depending on the tissue in the lymphedema arm, but certainly see a qualified lymphedema therapist to assess and diagnose which components and programs of a pump may be useful for you, but it's something that you can actually rent and participate in your own home for sort of 30 or 40 minutes a day. Most women, they tell me they sit watching the news or television show while the family are washing up, and that's their treatment time, their personal time, that's helping their arm in the comfort of their home. And they're pretty good value for money as well as a self-management strategy.
Do you know what the price is for a pump? Sorry to put you under the...
You can rent them for about $170 a month. And there's companies there that do a rent-to-buy system. So if you rent them for 3 months and you feel benefit from it, then they will deduct the rental price off the purchase price of the pump.
Yeah. So, John, I know you started... we talked about surgery pretty quickly. At what point should someone go, actually, I need to stop seeing just a physio who might have some experience in lymphedema and go to somewhere like Macquarie for much more substantial support?
I guess when, like the lady I mentioned earlier, desperately affecting their quality of life, desperately. Wendy's living with it so well, knows her new body, can work with it. But someone whose whole life is affected by recurrent cellulitis or, mood is affected, social life, becomes social outcast. I don't know, Louise, what else?
I would say the same, that you've been diligent with your conservative management for a long time, you're seeing your lymphedema therapist, but nothing is changing. And sometimes it's just worthwhile getting another opinion, getting an assessment to see are there other options for me? And sometimes as a therapist, I realise that I don't always offer surgery because I think, oh, they might not be able to afford it or they may not consider surgery. But it is another tool in the toolbox to consider. And for some people, they get really good benefit.
Yeah, and I think the most important bit is speaking up and not just thinking it's going to be okay, isn't it, Wendy?
That's
Wendy, what's your final bit of advice that you would give to people who are watching us today?
Be aware that it can happen any time. Watch out for it. Manage it. If you don't know how to manage it yourself, seek help from people like Louise and be very diligent. Be always looking out be aware it can happen any time.
So there has been so many questions that have been sent through. I hope we've tried to answer as many as we can and they're still coming through. So I'm sorry if we haven't been able to. If you do need help, I would encourage you to call our helpline on 1800 500 258 and talk to our nurses who can really help you to navigate this very complex and often difficult area of health service because there are simply so many out-of-pocket costs for lymphedema, which we truly understand. The State of the Nation identifies 8 urgent priorities for government to respond to. One of those, or in fact 2 of those, are around lymphedema. One is that we want a national compression garment program, which means that the South Australians are not the only ones missing out and that there aren't continued out-of-pocket costs for people with lymphedema. But the other is to make sure that we have its own Medicare number so that it is not caught up in the allied healthcare program of just 5 visits per year. So we would love you to help us be part of that advocacy program. And the best way to do that is to join our review and survey group. So go onto the BCNA's website and look up how you can get involved. And please join our review and survey group where we can ask you to be part of the campaigns. So we're working very hard with both sides of Parliament and we hope to have some very real outcomes being announced as part of the cancer plans for both Labor and Liberal into the future. So I would like to thank our very esteemed panel. It's been an absolute joy. It's so amazing how quickly the time goes by. To Louise, to John, and of course, Wendy.
Thank you, Kirsten.
Thank you so much. Thank you, everyone. Keep the questions coming through our helpline and please share this link with anyone else who's been affected by lymphedema. It will stay on our website for as long as you need us. Thanks so much for joining us tonight.